The major issue beginning May of 2020 with respect to COVID testing was there was a supply chain issue with respect to availability of the nasal swabs stored in viral transport media and the universal transport media. So when we applied for our emergency use authorization for COVID testing, we were using a conventional approach of extracting total RNA and then putting it into the DNA thermocycler for testing purposes. However, the process took us nearly 6 hours to purify RNA from 50 samples. And we did not have the capacity to test 150 to 200 samples that was required by Indiana Regional Medical Center. Indiana Regional Medical Center is a rural hospital that deals with patients in and around 50-mile radius of the city of Indiana, and it caters to nearly 500,000 patients. So for us and for IRMC and IUP, it became very important to collaborate and establish this partnership. Having started this testing process that early and having roadblocks with respect to the supply chain, I contacted Takara Biosciences to see if they could help us either directly processing the swabs and nasopharyngeal swab samples for the detection of viral RNA. And sure indeed, one of the representatives from Takara Biosciences contacted me and he said, we are piloting a PrimeDirect Probe kit for detection of COVID-19. And he sent me a free sample to test 50 to validate our testing process. Sure enough, this was in the month of July. By July 15th, we validated 50 samples and we got the approval process once again for the EAU, and we started rapidly testing now using this PrimeDirect Probe kit supplied by Takara Biosciences. Today, we are able to test up to 200 to 250 samples per day. This was critical for the hospital. This was very important for the community. This was very important for our university. Thus, Takara Biosciences not only reduced the time for processing the RNA, it also reduced our exposure time to the viruses and specifically COVID-19. And the third very important thing was there was not too much handling of the purified RNA or crude sample of the viral RNA for COVID testing. We have been so successful with this protocol that we have today that we are able to test up to 2 virus particles in some samples of COVID patients who have a very high virus load. So reducing the time was very critical for us. Takara Biosciences PrimeDirect Probe helped us to speed up the testing process and increase the capacity. That was key to the early testing challenges that we had.